or someone you love suffer from chronic kidney disease? Imagine reversing CKD stage 5 with a simple habit that only 1% of patients are doing. Intrigued? You're in the right place. According to the National Kidney Foundation, over 37 million Americans have kidney disease, but few know about this life-changing approach. In this video, we'll reveal how one patient's remarkable journey defied the odds and transformed their life. You'll discover specific, science-backed steps that can improve kidney function and potentially reverse severe kidney damage. Stay with us to learn how you can take control of your health and see real results. By the end of this video, we'll share easy, practical tips that you can start implementing today to boost your kidney health. Don't miss out on these potentially life-saving insights. Watch till the end to find out how you, too, can defy the statistics and reclaim your life. This can reverse kidney disease, but only 1% of patients are doing it. There's a huge problem facing the world right now, and no one is talking about it: the kidney disease epidemic. Every day, kidney disease causes more deaths than breast cancer and prostate cancer combined. It's the most unrecognized public health crisis we face. Here's the worst part: every time a patient is diagnosed, their doctor almost always tells them the same thing: there's nothing we can do, we have to wait for dialysis. But that's not true for everyone. Some patients have found ways to avoid dialysis, even in the advanced stages. Yes, that 1% of patients are actually reversing chronic kidney disease. There are ways to beat it, and I've seen people do it. Patients who lowered their creatinine levels in advanced stages of kidney disease, even when their doctors said it was impossible. That's why, in today's video, I want to show you what that 1%, the patients who are able to reverse kidney disease, are doing. The 4 good habits that will make all the difference. There are 4 good habits that can make all the difference in keeping your kidneys healthy. Keeping your kidneys free from toxins, chemicals, and harmful substances is crucial if you're serious about repairing them. But here's something many people don't know: keeping your mind free from toxic thoughts is just as important. A positive mindset is incredibly powerful. Never underestimate the impact of your mind. Clearing toxins from your mind can be as vital as keeping them away from your kidneys. Let me share Joseph's story with you. He's one of us.
My name is Joseph, and I was diagnosed with CKD 4 years ago. At the time, my GFR was around 27, and my labs were a mess. I had no idea anything was wrong. My kidney function kept getting worse despite all the pills I was taking, hovering around 17 or so. This went on for 3 years until I found your channel. I can't express in words how much hope you gave me. I never knew there were things you could do to slow down kidney disease. I turned my life around. In just 8 months, I felt better than I had in the last 4 years. 2 months ago, I went for a blood test, and my doctor was thrilled to tell me my GFR was back at 41.
He was in stage 4 and managed to reverse his kidney disease thanks to the habits he developed in just a few months, all thanks to an improved mindset. He found hope and got better. Finding hope in a difficult situation isn't easy, but science shows that a positive mindset is a deciding factor in the outcome of a chronic illness. Recent research even suggests that a positive attitude may be necessary to overcome a serious illness. Another reason why a positive mindset is key to reversing this disease is the ability it gives you to think outside the box. This kind of thinking has led to one of the most significant advancements in kidney disease treatments in recent years. Here's another tip: improve your gut health to support your kidneys. The digestive system plays a crucial role in removing urinary toxins, the wastes that damage the kidneys. This is something only the top 1% of patients manage to do, and it's one of the most powerful detoxing strategies out there. Take care of your mind and your body. These habits can truly make a difference. How can you find a probiotic that truly helps the kidneys? While there isn't a specific probiotic strain known to directly target kidney health, some strains may have indirect benefits. Look for probiotics containing strains like Lactobacillus acidophilus, Bifidobacterium bifidum, and Lactobacillus rhamnosus, as they have been shown to support overall immune function and may indirectly benefit kidney health. What makes this probiotic unique? The microorganisms in it use harmful kidney toxins like urea, uric acid, creatinine, and other wastes as nutrients for growth. This helps support the normal elimination of toxins from the body and kidneys. Additionally, it's the only supplement on the market that contains sodium bicarbonate, which protects the kidneys from acidity, and niacin and niacinamide, forms of vitamin B3, that block the absorption of phosphorus in the gastrointestinal tract. A special preparation with incredible benefits for diabetic kidney disease. Hey everyone, it's time to talk about the special preparation I mentioned at the beginning of the video. This remedy has shown amazing benefits for treating diabetic kidney disease. In a recent review of 24 studies involving 1,900 participants, those who drank a tea similar to this one every morning saw significant drops in creatinine levels and also lowered their proteinuria and cholesterol levels. This is Panax Nodo Ginseng, also known as G10. It's often used as an alternative or complement to caffeine, providing powerful energy and an incredible taste. But what many people don't know is its remarkable kidney-protecting benefits. Ginseng has been used for centuries to treat pain due to its anti-inflammatory properties. Research shows that the antioxidants in ginseng effectively protect the organs from inflammation and can boost blood flow, improving kidney function and lowering cholesterol levels. However, not all ginseng roots are created equal when it comes to health benefits. Which type of ginseng is best for kidney function? Let's explore the three most common types of ginseng. American ginseng. This is the mildest in terms of health benefits and has a relaxing effect. Panax red ginseng. This is the most potent type of ginseng, known for its powerful antioxidants and kidney-protecting properties. It's also the most expensive and hardest to find. I've made a full video about it, which you can watch for more details. Nodo Ginseng, Panax Nodo Ginseng. This is the one I want to focus on today. While it shares some benefits with Panax Ginseng, it is primarily used for its circulation and blood sugar-lowering properties. Diabetic kidney disease patients can see incredible results from this powerful herbal remedy. How to prepare a ginseng tea that works. Here's how you can prepare a ginseng tea that truly supports kidney function. Find good Nodo ginseng. Larger roots are usually pricier and better than smaller pieces. Dried ginseng can be tough to cut, so boil some water and steam the ginseng for 5 minutes to make it easier to slice. Prepare a decoction. Soak the ginseng pieces in water for 2 to 4 hours, or even overnight. Boil and simmer. Bring the water to a boil, then reduce the heat and let it simmer for about an hour. Strain the ginseng, saving the water. Repeat for a second decoction. Add another batch of water to the ginseng pieces, boil, and simmer again. Combine and store. Mix the first and second decoctions together. Keep the mixture in the fridge and drink it within 4 to 5 days. Finding a remedy that's perfectly tailored to your needs, like Nodo Ginseng for diabetes, isn't easy. But as we've seen, the results can be truly amazing. Kidney disease, up to stage 5, can be reversed if you do these 6 things. Have you ever been told that your kidney disease is irreversible? What if I told you that it doesn't have to be that way? Hi everyone, welcome back to our channel. Today, we're diving into a topic that could change your life: how to reverse kidney disease, even up to stage 5. According to the National Kidney Foundation, over 37 million Americans suffer from chronic kidney disease, and many believe their only option is dialysis or a transplant. But there's hope. Studies have shown that with the right lifestyle changes and treatments, you can improve your kidney function and potentially reverse damage. Imagine reducing your creatinine levels and improving your GFR numbers without the looming threat of dialysis. By watching this video, you'll discover 6 powerful steps that have helped countless others not only stop the progression of their kidney disease but actually improve their kidney function. These steps are backed by science and real-life success stories. Stay with us until the end, because you won't want to miss these crucial insights. By the end of this video, you'll have the knowledge and tools to take control of your kidney health and see real improvement in your GFR numbers. Let's get started on this journey to better health. Let's dive into what I consider the most powerful superfood in the world for boosting your GFR. This is a favorite among vegans, as it's one of the best plant-based sources of iron. It also boasts an incredible calcium content, with over 26 times the calcium found in milk. But that's not all. This superfood is packed with essential vitamins crucial for those with kidney issues, including vitamin B1, B3, B6, as well as folic acid, vitamin C, and more. Are you intrigued yet? Step 1. Spirulina. Yes, I'm talking about spirulina. This superfood is a game changer that I always include in my diet, and I highly recommend you do the same, especially taking around 1 teaspoon before bed. Why? Let me tell you. First, spirulina can significantly lower blood sugar levels, which is a massive benefit for those with diabetes. But that's just the beginning. Spirulina is also a powerhouse when it comes to controlling blood pressure, reducing cholesterol levels, and even aiding in weight management. Numerous studies back up these incredible benefits, making spirulina nothing short of amazing. Researchers attribute spirulina's kidney-protecting magic to its potent antioxidant properties. In fact, taking just 1 to 8 grams of spirulina per day can yield significant health benefits. So, here's my tip for maximizing the benefits of this superfood: consume it in the evening or before bed. Spirulina is rich in tryptophan, an essential amino acid that helps your body produce serotonin and melatonin. Serotonin is crucial for mental health, while melatonin is the hormone that regulates sleep. By having spirulina before bed, you may enjoy better sleep, which is vital for kidney health. While spirulina is fantastic, it's important to note that it may not be suitable for those with autoimmune diseases like lupus or rheumatoid arthritis. However, for most people, the benefits of incorporating spirulina into their diet are too significant to ignore. Just be sure to choose a brand that certifies the purity of the product. And remember, spirulina is also a source of protein. For instance, half a tablespoon, about 3.5 grams, provides around 2 grams of protein. While that might not seem like much, it's essential to keep track of your daily protein intake, including what you get from spirulina. Managing protein levels is crucial for those with kidney concerns. So, are you ready to give spirulina a try and unlock its incredible benefits? Step 2. Never lose hope. Now, let's address a crucial question that I'm sure many of you are asking. Is it really possible to improve your GFR in stages 4 and 5 of CKD? The answer is a resounding yes. And this isn't just wishful thinking, it's backed by solid scientific evidence. According to a study published in the journal PLOS One, which analyzed data from 406 patients with CKD, improvement is indeed possible. The researchers found that 62 patients, 15.3%, showed a sustained improvement in their GFR over time, with an average increase of 1.88 milliliters per minute per year. Remarkably, many of these patients were in stage 5 pre-dialysis and still managed to experience very slow disease progression. So, what does this mean for you? It means there's real hope for improving your kidney health, even in the advanced stages of CKD. It means you shouldn't give up on your kidneys. Instead, you should collaborate with your doctor to find the best treatment plan for your condition. It means you should follow the steps I'm about to outline, which are based on the latest scientific breakthroughs and proven to help slow down or even reverse the progression of CKD. The aim of the study wasn't just to prove that GFR improvement is possible at any stage of CKD, including stages 4 and 5, but also to identify the factors associated with GFR improvement. So, are you ready to discover these life-changing steps? Let's dive in. Step 3. Key factors. Here's a vital question. What factors are crucial for reversing the decline of GFR? In the study we just explored, achieving a higher number of therapeutic targets was directly linked to a greater chance of stopping or reversing the decline of CKD. We need to ensure we're hitting these targets 100%. The study highlighted 5 key targets. Let's dive into what they are. First, blood pressure. It's evident that managing this is absolutely crucial. Second is proteinuria. Spoiler alert, this turns out to be the most important factor. We'll delve deeper into this later in the video. Third, the use of renin-angiotensin system blockers. Fourth, the number of complications present, anemia, hyperphosphatemia, metabolic acidosis, and hyperkalemia. Addressing these complications made a huge difference. Fifth, diabetes. Managing this is obviously very important. So, how do you achieve the targets outlined by this critical study? Stick around, and we'll break down the steps to hitting each one and improving your kidney health. Let's get started. Step 4. The targets. First things first. Keeping your blood pressure in check is non-negotiable. The experts can't emphasize this enough. Aim for a reading below 130/80 millimeters of mercury. It's crucial not to exceed this limit. In my videos, I often dive into natural methods to hit this target: regular exercise, watching your sodium intake, maintaining a healthy weight, and even incorporating specific natural supplements can all make a significant difference. But let's face it, not everyone can manage their blood pressure without medications, and that's perfectly okay. It's not your fault. If you need medication to control your blood pressure, that's completely acceptable, but it's vital to ensure you're using the right ones. Now, this can be a complex subject, which is why I recently dedicated an entire video to it. You can find it up here if you're eager to learn more, and also down in the description. Taking charge of diabetes control. Another critical therapeutic target is managing diabetes. According to the study, those who showed improvement were less likely to have diabetes mellitus compared to those who didn't. Unfortunately, having diabetes does make improvement less likely, but it's not impossible. In fact, among the 62 individuals who saw improvements in their GFR, 9 had diabetes. It's essential to note that diabetes can be reversed, and this is pivotal for safeguarding kidney health. But wait, there's more. There's a key point coming up that's even more critical than diabetes and high blood pressure. Don't miss it if you're serious about turning the tide on your GFR numbers. Step 5. Managing complications. Complications are the sneaky adversaries that kidney disease brings along for the ride. They're the issues that can deal a serious blow to your kidneys. Think hyperphosphatemia, metabolic acidosis, anemia, hyperkalemia, and elevated parathyroid hormone levels. Each of these complications demands attention if they're present. Here's the kicker: many doctors tend to overlook these complications, and that's a big problem. Take anemia, for instance. It's a common complication of kidney disease that can lead to fatigue and hasten the decline of your GFR. Shockingly, many patients aren't getting the treatment they need, and some aren't even being tested for it. That's why I urge you to educate yourself about anemia. If you're experiencing symptoms like fatigue, shortness of breath, headaches, or even cold hands and feet, check out my video on anemia. It's linked up here and down in the description if you missed it. Thyroid issues are another often ignored complication, just like anemia. Many people with thyroid problems don't even realize they have them. Hypothyroidism, where the thyroid doesn't produce enough hormones, is especially prevalent in those with CKD. Hyperthyroidism can cause a slew of symptoms, but they can easily be mistaken for other conditions. It's crucial to ask your doctor for a thyroid test. Treating thyroid problems could potentially lead to improvements in kidney function. Hyperphosphatemia, or too much phosphorus in the blood, is a common and dangerous complication often seen alongside metabolic acidosis. Both can be managed with the right diet. Think less meat, dairy, fish, and processed foods. Hyperkalemia, or high potassium levels, is another tricky complication. It's a bit of a hot topic because the causes aren't always straightforward. While reducing potassium intake used to be the go-to solution, we now know it's not that simple. Unmanaged diabetes, metabolic acidosis, and certain medications can all play a role. Keeping potassium levels in check is essential for preserving kidney function. If you're dealing with any of these complications, make sure you're getting tested and treated properly. Ignoring them could accelerate the decline of your GFR. Stay informed and proactive. It could make all the difference in safeguarding your kidney health. Step 6. Beat proteinuria. Number 6. This is probably the most important step in order to reverse the decline of your GFR numbers. This step is definitely one of the most important things you can do to help your kidneys. Proteinuria, also known as protein in urine or albuminuria, is the most powerful predictor of kidney function decline in all stages, which means that there is no improving if proteinuria level is not under control. And this is true for people in all stages of kidney disease. So when it comes to proteinuria, our goal should be to keep this level below 30 mg per gram because, as we can see here, the higher the proteinuria, the higher the chance of kidney disease progressing to a worse stage. Okay, so how do you make sure your proteinuria is not too high? There are strategies that actually work. There is a vitamin that's needed to keep proteinuria under control, there are foods that can help, and of course, there are medications that can be used. There are actually 2 new medications that doctors are just starting to prescribe and that can make a huge difference with proteinuria and consequently with CKD. I've covered more about this in my recent video. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all.